Good afternoon, everyone, and happy Friday. Thank you for joining us on your lunch break for another great Talk with HIROC LinkedIn Live session. I'm Mark Aiello, Communications and Marketing Coordinator at HIROC, and today I'm super fortunate to be joined by my esteemed colleagues, Jennifer Quaglietta and Arun Dixit, who are going to be talking to us today about a paper they co-authored with our CEO, Catherine Galton, on how organizations can prepare boards and leaders and risk managers for a future with artificial intelligence. But before we begin, I would like to take a moment to talk about land acknowledgements and why they're necessary. So, inspired by the 94 recommended calls to action in the Truth and Reconciliation Commission of Canada, uh, land acknowledgements at any time, including gatherings like this event, are a necessary first step toward honoring the original occupants of this place. They also help Canadians recognize and respect Indigenous peoples' inherent kinship beliefs when it comes to the land, especially since those beliefs were restricted for so long and continue to be restricted. So today, myself and my colleagues are speaking from Toronto. This land is the traditional territory of the Anishinaabe, including the Mississaugas of New Credit and the Haudenosaunee, as well as the Wendat. So today, this gathering place is home to many Indigenous people from across Turtle Island, and we at HIROC are grateful to work on this land. Now, regarding a few announcements, a reminder that any resources mentioned in today's talk can be found via links in the comment section of this broadcast. So we have a number of links that we'll be talking about today, and you can find them all in the comment section. If you have any questions for Jennifer or Arun today, please feel free to ask them at any time in the comment section. And if we have time, we'll be answering them closer to the end of the show. But if we run out of time, we'll be sure to connect with you after the show to answer them. Also, our HIROC conference is coming up very soon. And so on October 18th, 19th, and 20th, you can join us virtually as we gather together as a community and try to make an impact now on patient safety. A link for registration and to see our lineup of speakers and session topics will be available for you in the comment section. And that's all I have for announcements. So you guys ready to jump into it? So in this paper about artificial intelligence, you identify AI as an area of opportunity, something that organizations can leverage to increase safety and improve quality. And you underscore that with an emphasis on the need for careful risk management around AI development. Can you tell us a bit about the risk management framework outlined in the paper?
Yeah, it's a great question, and I would maybe start with a brief definition of AI to perhaps motivate our talk for today.
Right.
So, artificial intelligence refers to the ability of machines to mimic complex cognitive functions that are normally associated with humans. And sophisticated examples can include learning tasks such as identifying objects that are contained within an image, and problem-solving tasks such as online translation tools that can identify text, detect which language that text is written in, and reasonably accurately translate that to another language. And one of the things that makes AI challenging is that while algorithms can perform human-like tasks, they don't necessarily follow the same logic pattern as humans do to arrive at a decision. And in the case of image recognition, humans have years of experience that allow us to know if we are looking at, for example, a photo of a dog, even if that image is blurry or occluded. AI systems must be carefully built using countless of training examples in order to be able to perform the same task effectively. So that being said, AI carries a unique risk profile that must be mitigated. And in our paper, we talk about several risk types that can occur in AI in healthcare, and we present suggestions to leaders for mitigation. Just as an example, AI systems can be built using a wide range of data from many disparate data sources, and therefore strong governance and ongoing cybersecurity steps must be taken in order to ensure that the integrity of these systems are being maintained.
Mm-hmm. Yeah, and what's interesting is we're seeing AI actually pop up a lot more as healthcare organizations across Canada use it to innovate and automate. Can you share, maybe a recent example of a practical use for artificial intelligence?
Sure, absolutely will, Mark. And as you said, AI has been around for some time, but I'll start with one of the classic examples that we often see and is talked about in the acute care or the hospital sector, where the hospital has co-developed a software application that can read and provide feedback on medical images. And the classic example is X-rays and ultrasounds. The software can address an important challenge, which is that only a small percentage of radiological images undergo a peer review process. Fortunately, AI systems have this ability to scan through a large number of related images, and they can recommend diagnoses for a patient. But in this context, the main benefit is that the AI system can help enable an automated peer review for every single patient.
Mm-hmm.
Now, this may potentially lead to the benefit of improving safety and outcomes for everyone. And moreover, during the deployment, the system can be adjusted as it's fed more data so that it can continuously learn and improve on its performance as each new image is uploaded into the system. This is also a great example of, for those of you, in the healthcare sector, you've heard of the learning health system model in action. And as AI systems have been designed in collaboration with clinicians and other stakeholders, it can be used within a cycle of this sort of continuous improvement model to improve processes and safety, and ultimately the delivery of high quality, safe, and effective care.
Right, and you mentioned the reviewal process, and this paper, focusing on preparing the leadership specifically for that future. What can board members and senior leaders do to better understand this rapidly changing environment?
So you're right that it is a rapidly changing environment indeed. And it seems like almost every week or even possibly every day, there are new ideas and new research studies that are being published that are changing the landscape of what is possible with AI. And even just thinking about that can almost be overwhelming when you see the volume of material that's being published. And one piece of advice that I would offer is that large transformative initiatives, such as those that involve AI, they're best described as a collaborative team endeavor. And with that in mind, there are several organizations that provide valuable thought leadership and guidance on the technical aspects of AI, particularly in the Canadian healthcare setting, as well as to help give a bit more insight into the art of the possible. What's possible with AI in a Canadian healthcare context? Examples of these organizations include in Alberta, there's the Alberta Machine Intelligence Institute, the Vector Institute located out of Ontario. There's the Newfoundland and Labrador Center for Health Information. And in Quebec, there's the Montreal Institute for Learning Algorithms. And these are just but a few examples of organizations that conduct research and provide thought leadership in the technical AI space, but also have many examples of research publications that can be found on their sites and can be useful for informing the state of the art, again, particularly in a Canadian healthcare landscape. And this can be useful for guiding leaders and senior leaders around possible areas for AI adoption in their organizations. With respect to practices within an organization, probably the best advice that I could offer is the need to develop strong governance and oversight practices to support the management of any AI initiative within their walls. And for further guidance on risk management and for advice for leaders on how to establish organization-specific practices, we encourage our audience to look at HIROC's Guide on Risk Management for Artificial Intelligence in Healthcare. This is a free resource that can be found on HIROC's website, and a direct link is provided on the screen during our talk today.
Yeah, yes, that's right, and you could also find it in the comments section as well. And it's funny that you mentioned that the risk managers that are reviewing things like this. I can imagine putting yourself in the mind of a risk manager that has all these innovative projects, AI coming across their desks. What practical advice would you give risk managers who are faced with really balancing these projects?
Thanks, Mark. That's a great question. So here's a couple of thoughts that I would like to share today. One important consideration is really around the ethical use of AI systems. Now, there are several questions related to this topic, including, what services, care pathways, or client populations have the highest burden or need? And can AI actually help to promote fair, equitable access to healthcare services for the benefit of everyone? I've seen articles which suggest that access to primary care can vary widely, even between adjacent neighborhoods in a city. And the effectiveness of AI actually depends on the availability of robust, representative data, and the pursuit of any initiative must be seriously questioned if data that accurately represents an entire population and its needs do not exist. Moreover, since the 1960s, thousands of AI models have been developed. However, very few have been implemented in true practice today. And this raises the question of why. One of the many considerations is that the interaction between humans and AI systems hasn't been really developed to its fullest. The intent may be to create more time between clinicians and patients, but AI systems could lead to unintended consequences just the same, such as increased time spent between humans and computers. Greater involvement, I think, of all stakeholder groups, including patients and families, is really a key enabler of the viability and longevity of some of these AI systems that are being considered today. And to provide further support to our subscribers, of course, and the healthcare sector, we are, of course, happy to announce a newly published paper titled Preparing for the Future: How Organizations Can Prepare Boards, Their Leaders, and Risk Managers for Artificial Intelligence, which will provide further information and guidance on risk management for risk managers as well as the entire organization. And you'll see a link to this paper being provided on the screen during our talk.
Yeah, very nice. And outside of these wonderful resources that HIROC has, of course, the Preparing for the Future paper that we're talking about today, and of course our AI guide. What other resources would you recommend to healthcare organizations who are also considering or currently working closely with AI?
One example that I would offer is the Learning Health System, which is a valuable model for considering the operationalization of informatics systems. And it can also be applied to the adoption of AI. And so broadly, this model is intended to support how organizations identify key insights and information based on a true problem of interest in a true area of need, turn that knowledge and insight into action, and sustain action to create long-lasting change. There's a lot of information that we could cover just on the topic of a learning health system, and a link to more information about this model and advice on how to put it into practice can also be found in the comments section for this talk. And on behalf of our patient safety and risk colleagues, I would also share a link on the notion of Safety 1 and Safety 2. This is a critically important concept in the world of safety science, where Safety 1 refers to the idea that an organization should strive to reduce unwanted outcomes such as accidents or injuries. And Safety 2 is the idea of looking at the high percentage of cases where things go right and things worked the way that they were supposed to, and trying to find out what are ways to spread and standardize those actions consistently and constantly across the healthcare system. We've provided a link to a guidance document with more information on the subject from the National Health Service in the UK, and we encourage organizations to pursue applications of AI that involve both a Safety 1 and a Safety 2 perspective.
Very nice. Yes. And I guess, for my final question, who can HIROC subscribers reach out to at HIROC if they have any questions, about coverage or any risk management related to AI?
We would be most happy to provide further information, Mark, to any of our subscribers, and they can contact us at inquiries@hiroc.com.
Yes, and yeah, that's right. Inquiries@hiroc.com. And you guys have been so great. Thank you so much, for coming on. I'm just going to check real quick to see if we have any questions. Oh, we do have one from Philip, who says, "What are you both excited about when it comes to AI innovation? Like, what kind of what's out there now that you're excited about?"
one of the things that I'm very much excited about is I think we're getting to the point where AI is starting to become more and more adopted, and widespread in situ applications are starting to become the norm. So we're kind of at an interesting point where we're literally able to watch AI transition from work that had been done over the past few decades in a research setting, focusing on getting kind of the foundations and the fundamentals right, now to the point where we're starting to see more and more of a shift and more of an adoption of these technologies in practice. And that's really exciting to see when we think about the possible AI that's possible. The innovation that's possible within the Canadian healthcare landscape as a potential opportunity to reduce some of the burdens that overstretched healthcare systems face today. When we think about the vast potential for AI systems to look through large amounts of data, analyze large amounts of data, support and strengthen clinical decision-making workflows, these are opportunities that can certainly make healthcare workflows and systems safer for patients, safer for staff, safer for everyone who's involved, and really can, as I said, help alleviate some of the burdens on these systems that are being stretched more and more every single day.
Right. And Jennifer, did you have an innovation?
Yeah, I was just going to bank on to what Arun was saying.
Right.
I think the future is really looking at how we can leverage, as Arun mentioned, all of the expertise and the tools and the insights that some of AI and machine learning will produce, specifically on the grounds and at the bedside. And a great example would be, natural language processing, and how can computer systems start to help to provide those insights faster and quicker to alleviate the resources that are needed specifically at the bedside, while leaving the computers to do the hard crunching behind the scenes.
Yeah, you can imagine all the different benefits coming down the pipeline. There's a lot of it's definitely exciting times in healthcare when it comes to finding the different ways that we could apply AI. So I guess without further comment or question, again, thank you both for coming on Talk with HIROC today to talk about the future with artificial intelligence. And as always, it's a big thank you to your audience, to our audience, for joining us today and watching along. A recording of this show will be available on our LinkedIn page right after the broadcast is finished. So if you'd like to rewatch the show or share the recording with your organization, you can do so by going to the videos tab after the show. As I mentioned earlier, you can find all links to the resources discussed today, including the Preparing for the Future paper on AI that we discussed, that Arun and Jennifer worked on to create, as well as our CEO, Catherine Galton. And you can find that in the comment section of our broadcast. We encourage you to download these and, of course, share them widely at your organization. There's also a registration link for the 2021 HIROC conference happening October 18th, 19th, and 20th. So if you haven't already registered, we encourage you to please do so. And that's all for this session. Thank you again, and we'll see you on the next one. Take care, everyone.